of you have heard of anorexia nervosa, bulimia nervosa, and maybe even binge eating disorder. But do you have a good understanding of how the DSM-5 distinguishes amongst these three disorders? Sometimes I think our everyday knowledge of these disorders, our everyday notions of what they are, influence in a negative way our ability to differentiate how the DSM-5 diagnoses them. The central feature of anorexia is low body weight due to restricted food intake. Right? People who get diagnosed with anorexia have to have this low body weight issue. And in addition to that, they tend to experience things like a fear of gaining weight, and they have a very distorted sense of their body shape. Right? They tend to see themselves as overweight when other people look at them and see them as frighteningly underweight and unhealthily underweight. Right? But their distorted sense of body shape negatively affects how they feel about themselves. But the key element, the thing that has to be present for an anorexia diagnosis, is a failure to maintain minimal body weight. What about bulimia nervosa? Bulimia nervosa is characterized by binge eating, followed by compensatory behavior. Binge eating is when somebody eats a huge amount of food in a single sitting, more than most people would eat during a comparable period. And the person who's binging has a feeling of being unable to control or limit how much they eat. So they might gather a whole bunch of food around them and in a short period of time eat all of it and feel out of control in doing it. But then you also have to have some kind of compensatory behavior. Right? Compensatory is a fancy way of saying compensate. And compensatory behavior is behavior that's intended to counteract having binged. And there's different kinds of compensatory behavior. There's purging, where the person actively removes the food from their body. That's one type of compensatory behavior. So examples of purging would be things like self-induced vomiting, misusing laxatives or diuretics, or other drugs. And the intent in all of this is to get the food that you've eaten out of your system, to purge it from your system. But purging, although it's the most well-known compensatory behavior, isn't the only compensatory behavior. Some people engage in nonpurging compensatory behavior. These are types of behavior that counteract the binging without removing the food from the body. So things like fasting and excessive exercise are non-purging examples of compensatory behavior. Right? Somebody might binge, and then to compensate for it, they go to the gym and they work out for an excessive amount of time. Right? Or they decide they're not going to eat for the next 3 days as a way to compensate. They're not actively taking what they've binged out of their system, but they're doing other things to try to make up for the fact that they binged. One of the things that makes distinguishing anorexia from bulimia difficult is that anorexia has two subtypes in the DSM-5. One is a restricting subtype, where the person loses weight mainly by dieting, fasting, and exercising excessively, but they don't binge or purge. And the other is a binge-eating purging subtype, where the person does engage in binging and purging. And this can easily get confused with bulimia, but the difference is that when somebody is doing it, but they're also not maintaining minimal body weight, it's always diagnosed as anorexia. Right? If you think about it, some cases of anorexia can involve binging and purging, right? If the person has the binge-purge subtype of anorexia. But some cases of bulimia can involve only non-purging compensatory behavior. So if somebody binges and then only compensates for that by excessive exercise and fasting. Both anorexia and bulimia need to be differentiated from a new disorder in the DSM-5 called binge eating disorder. And basically, binge eating disorder involves recurrent binge eating episodes that occur once a week for more than 3 months. But there is no compensatory behavior of any kind. Obviously, distinguishing anorexia from bulimia is important because severe anorexia can seriously endanger somebody's life. Beyond that, when it comes to treatment, however, it's not always clear how important it is to distinguish anorexia from bulimia from binge eating. For example, enhanced cognitive behavioral therapy for eating disorders, or CBTE, maintains that all eating disorders share a core psychopathology, one in which people base their self-worth not on their achievements, but on their ability to control body weight and shape.